Hello everyone, my name is Marwan and today I'll be talking about the anatomy of the elbow joint using complete anatomy program. Here's the list of what I'll be covering in this video and let's get started. The elbow joint is uniaxial hinge type synovial joint, and synovial joints have some characteristic features. For example, they have fibrous joint capsule, synovial membrane, and some other characteristic features that I'll be talking about them later in this video. Now there are three bones that are involved in the elbow joint. We've got the humerus, the radius, and the ulna. And also we've got three articulations involved with the elbow joint. Firstly, the articulation between the humerus and the ulna, and that's called the humero-ulnar joint, which is a hinge joint. Secondly, the articulation between the humerus and the radius, and that's called the humero-radial joint, and that's a limited ball and socket joint. And thirdly, the articulation between the radius and the ulna, and that's called the proximal radio-ulnar joint, and that's a pivot joint. Now let's take a look at some of the features of the articulating surfaces of the bones. The articulating area of the humerus has two parts. We've got the trochlea and the capitulum. So the trochlea is medial and it articulates with the trochlear notch of the ulna, and the capitulum is lateral and it articulates with the head of the radius. There are some further features that we need to know about the distal humerus. So we've got three foci. One is the conoid fossa here, the radial fossa here, and on the back of the humerus posteriorly we've got the olecranon fossa, which articulates with the olecranon on the ulna. And there's also the epicondyles. This is the medial epicondyles and that's the lateral epicondyle. Now the movements of the elbow joint are flexion, extension, pronation, and supination. Now let's talk about the innervations of the elbow. Anteriorly, we've got the median nerve, the musculocutaneous nerve, and the radial nerve. And posteriorly, we've got the ulnar nerve. Okay, now let's take a look at the joint capsule and the ligaments. So we've got four ligaments. This is the ulnar collateral ligament. That's the radial collateral ligament. This is the quadrate ligament, and that's the annular ligament. And then we've got the joint capsule, which can be separated into a fibrous and synovial membrane. The synovial membrane is located underneath the fibrous membrane, and these membranes are separated from each other by fat pads. Now let's take a look at some of the conditions that occur in the elbow. Tennis elbow or lateral epicondylitis is a painful condition of the elbow caused by overuse or inflammation of the tendons of the common extensor origin. Overuse of the extensor carpi radialis brevis can cause microscopic tears in the tendon where it is attached to the lateral epicondyle, causing inflammation and pain on the elbow and weak grip strength. Golfer's elbow or medial epicondylitis is a painful condition of the elbow caused by overuse or inflammation of the tendons of the flexor muscles. Overuse of these muscles can cause microscopic tears in the tendons where they attach to the medial epicondyle, causing inflammation and pain on the elbow and weak grip strength. If pain and inflammation persist, surgical intervention may be necessary. This animation illustrates a procedure that aims to relieve pain on the medial elbow associated with the condition golfer's elbow. An incision is made on the skin immediately between the tendons of the flexor carpi ulnaris and the palmaris longus muscles to allow instruments to access the region. Retractors part the skin, gaining access to the damaged tendons, which typically include the tendons of the palmaris longus and the flexor carpi radialis muscles. A portion of the damaged tendon is excised of the bone where it normally attaches. A K-wire is then used to microfracture the bone, which aims to stimulate a healing response in the tendon and surrounding tissues. We've reached the end of the video. Thanks for watching!